All right, we should be starting soon.
Okay, I'm ready.
No, we'll wait 3 more minutes.
Okay.
It's 56, so yeah. Video. All right. Yeah, the lighting is quite bad here. Let's see. No, this is not any better.
Yeah, because you have a window that
yes,
is,
I do.
yeah, making it darker.
Okay.
So if you put your laptop towards the
Must
window,
be
then
very
you'll
familiar with.
there you go.
Oh,
There you
you're
go.
right. I see a big change.
Yeah.
Yeah. Have you been teaching online?
Yes, in fact, yeah. Several classes.
That's different, yeah. Yeah, I always wonder why my picture was so dark, but you're right. It's the light.
It's the light.
Okay. All right. Okay, 2 more minutes and we'll get going. Hello, Amy. Okay. Okay. Good afternoon, everyone. Can you hear me? Can you? Azizur, can you hear me?
Yes, I can.
Okay. All right. Good afternoon, and thank you for taking the time to be with us virtually on this snowy day. My name is Jack Mangala, and I'm the chair of the Area and Global Studies Department here at Grand Valley State University. We are very pleased to have with us today Dr. Azizur Molla. Dr. Molla is a professor for the Master of Public Health program in the College of Health Professions at Grand Valley State University. He is a medical anthropologist with experience in community health, environmental health, program evaluations, health education and promotions, and research methods. He has over 17 years of college and university level experience in teaching and doing research on health in South Asia and the US. Dr. Molla also worked with the US Agency for International Development in designing, implementing, and assessing reproductive and public health programs in South Asia. He also coordinated and provided training on global health, reproductive health, and healthcare system to health officials in Bangladesh and Indonesia. Dr. Molla's lectures today is titled COVID-19, a testimony of global health in recent times, the power of politics, people, and progress. This is a timely topic indeed, and we are very pleased that you have decided to join us. So without any further ado, I will let Dr. Molla take over, and I will see you on the other side for the Q&A sessions. Okay. Up to you, Azizur.
All right, thank you, Professor Mandela. It's my pleasure to talk on the topic. And thank you so much for the elaborate introduction of me. Nothing to be said more about it. So you are right that this is a very timely topic, and that's the reason I picked it up. So we'll be talking about COVID-19, a testimony of global health in recent times, the power of politics, people, and progress. This talk will be basically sharing that what happened to global health. Global health is an institution, it's a global movement that should take care of any global health problems and other things in a collaborative fashion. What went wrong? We don't see that kind of a effective and efficient presence of a global institution like World Health Organization. So we'll be discussing about that. Specifically, I'll be talking about giving a definition of global health so that we all are in the same boat, same understanding, then a brief history so that we can understand that how it started, how it is expanded, and then now it is kind of struggling, what happened in there. And we'll be having in-depth kind of understanding about global health in reference to COVID-19 particularly, or any similar kind of a virus. Then after the in-depth view, we'll try to understand, share some statistics, and also finally have an kind of analytical views on what is the power of politics, power of people, and power of progress in respect to COVID-19. And I'll share a concluding slide before we start the discussion. According to my understanding, that we'll be spending a good amount of time, maybe half or more than half of our 1 hour time on discussion, so that we can learn from each other, and it will be my pleasure to answer some questions and bring up some other related topic as well. So whenever we think about global health, it's in simple, it's definitely an area of study, area of doing research, and also practice that places a priority on improving health and achieving health equity for all people worldwide. So from this definition, we see that a global perspective is there, and also health study, research, and practice is involved in there. We also see that another definition that is go beyond a nation. So whenever I think global health is not limited within one nation, but later on I will be sharing that how if a nation doesn't have any good public health structure or setup, those nations cannot be as effectively handling like health challenges like coronavirus, and we'll be talking about that. So what we are seeing in here, and if you put in analytical skills, that global health, all global nations are not equally powerful in terms of technical know-how, training, and financial resources, or even health structure-wise. So how a global health commitment or goal then will be implemented. So we'll be talking more about that. Let's kind of a review history of global health. If you take a look on 1892 or 1893, at that time, there were some international conventions or organizing in mostly in European areas and European nations, and Turkey was also included as a European nations. But the big problem at that time they are talking about is sanitation, cholera outbreak. All this part I was talking about. So cholera outbreak is going to like all the Suez Canal area and other things. So as a result, the surrounding people and nations, and also particularly who are using that Suez facilities, are concerned that what is going on. So that single disease was not consisted within one nation. It go beyond one nation, and many people, particularly the 12 European nations, got together and they're having some convention on that. And the first thing we see that similar pattern, we see that Mecca pilgrimage, there's a huge sanitary problem happened in there in 1894 as well. Later on, we see the global scale, the plague was playing a big role at that time. And whenever plague happened, we didn't find that global community was involved with that health challenges because only one nation or some European countries are involved with that. So we see the kind of absence of global health in there. Later we see that in fact in 1902, there is some International Sanitary Bureau was later on is called Pan American Sanitary Bureau, was founded in December 1902. Interestingly, the Europeans should have founded their International Sanitary Bureau first, but they were taking time, so the Americans take the lead on that. So that was interesting part. Whenever we see kind of a many history, environmental health, global health, US is very good in taking a lead on certain areas of improvement, specifically on health. But in 1907, what we see in here, that same 12 European nations, they have an international, they call Die Heisen Public in Paris. That was the very first home base for talking globally in respect to health. And this, in fact, home base was giving them power to collecting disease statistics. You may know that disease statistics was initially collected by churches. Many churches was involved collecting some vital statistics of people, whenever they're born, what is happening, so on and so forth. But they have been doing that for long. If I exclude that Persian Gulf, like Ibn Sina era, and later on the other part. So it's basically document-wise, we see that church played a very good role. And now in 1907, we see that this home base in Paris was collecting disease statistics, study of epidemic of the diseases, and also implementing some measures that was taken in that international kind of a forum. So that was a great improvement, also development, I see that from global health point of view. Later on, we see the Rockefeller Foundation, particularly in reference to US. They come up, even though they are not, there is non-governmental organizations, philanthropic organizations, but they had huge role in 20th century. Particularly their International Health Division was working in parallel to the League of Nations of Health Organization. You know that was the League of Nations of Health Organization, is basically today's World Health Organizations. So we'll be talking more detail about that. So what happened at 1919 and 27, we see that is many organizations like League of Red Cross, Save the Children, and also International Institute for Protection of Childhood, different kind of organizations that's coming up is basically let's work together to implement our global health agenda or plan like that. So that was a great thing, but it's kind of a flourished if we in the time of 1946 and 1948, and in fact in today's in contemporary time as well. So WHO, the World Health Organization, as the permanent international health agency, it seemed that everyone was then looking at it, hey, if it is a global health or international health, it is your responsibility. So we got a kind of a consensus, every nation was talking about, we got a platform that should work. There was a gradual increase of funding by member states, including USSR at that time. They played a good role. They usually do not play that much of role in globally in compared to US's leading role. But many nations like that, definitely including US and European countries, played an important role in there. And so big thing we see after the formulation of World Health Organization, we see the specific goals of setup. Recent goals, you may remember that they got Millennium Development Goal. So the World Health Organizations and some other agency together just set some goal to be achieved by every member nations. So that was achieved, and in fact, many countries did pretty good job on that. Currently, they are implementing that Millennium Sustainable Development Goal. So they are setting things so that people in most of the nation, they can sustain the access to safe water, access to improved sanitation, this sort of thing. So that is kind of going on, eradication of certain disease. So that is a big thing. So if we consider the contemporary role of World Health Organization, they in fact should take the leading role. It may be Ebola, H1N1, or coronavirus today. So that has been doing, but they have some limitations though. So they have great successes, but they have some challenges, particularly resource and manpower wise, they are not equipped. And in many cases, we cannot even compare CDC, our CDC with WHO, because CDC is way, way above in terms of quality and also role that playing in fact, not only within US, globally. So that is another institution playing a very, very vital role. Now, whenever I think about global health, if you take like a binocular, what we understand, it builds on international health interest, but it's in high-income countries over centuries ago. So it's basically the leading of a high-income country. Many people, in fact, told us that global health basically divorced the health needs of low and middle-income countries, with the notion that they are not getting proper allocation of medicine, proper allocation of treatment, proper allocation of many, many programs, because those countries cannot really contribute much. Later on, what we are seeing that many people that if a nation doesn't have any strong national public health institution, it is very difficult to really implement global scale health stuff. And we saw that in very clearly in Ebola time. When Ebola time, US in fact has taken the lead role to take care of Ebola threats. And so whenever a army, a brigade was deployed in African countries, and they understood that they don't have bare minimum, they have almost nothing to face a big scale health threats. In fact, normal primary care is not possible with the structure they have. So all those kind of lessons we learn from there. You may understand that or know that Paul Farmer, who is a professor in Harvard, and he has created an institution called Partners in Health. In fact, one of his motto is like expand global health and reach global health to the unreachables or the needy people, using his own money and the organization's money. So that was very, very, he has many observations about global health. He told that global health is basically limiting is in communicable diseases and maybe like smallpox to AIDS and some minimum surgery that is needed. But he was promoting that we need to take or broad global health in a bigger scale surgery so that who are expert in Western world, they can utilize their skills to treat some or do some surgeries in the people. Without those surgeries, some people will be dying, and many people are dying recently. So that was a very good, in fact, analogy from Paul Farmer and also his colleague Kim. You may know that Kim is the later on became the president of World Bank. So what the recent pandemic suggesting is the spirit of global health is hampered due to the cost, because there's many factors involved, including the cost factors, and that was not easily understandable that a nation can handle and buy expensive coronavirus doses, vaccine doses. That was a big problem for them. So national public health agenda may not be as successful because it should be a global health agenda. Otherwise, a single nation cannot handle really a big challenges like coronavirus or reach out the vaccines before that. If we conclude that WHO, the World Health Organization, is still leading force, but are they equipped to handle challenges like that? No, that is what we noticed. But if you take a look, see and hear that WHO coronavirus dashboard, they are keeping statistics and sending out their experts whenever it is needed. So that was a great, in fact, improvement. If we like slash down the WHO's role, then who else is there to work on every nation states? So that is really these institutions playing a very, very important role, I should say. Now, what is happening in US? See, US situation is like, we are still seeing that new cases of coronavirus coming in, and there is deaths still happening, which means why that is happening? Why it's like almost 2 years? Why developed nations like US is paying such a big price? So we need to talk about that further in an analytical way. If I compare US and world situations, take a look that percentage-wise, the US is 60.1% vaccinated, and globally 42.7% vaccinated. So if anyone is evaluating the role of global health, still it is doing pretty good job in there because it's closely covering all the nations. But if we separate, see the by nations statistics, then we may not be as happy as we are now, because certain nations may not be even 2% of their population is vaccinated, because they don't have the technical know-how, they don't have the structure, they don't have money to buy all those jabs and other things. So that is the big challenge is happening right in there. We see what is happening in Michigan. Take a look in Michigan. We are seeing 61.8% finish both the vaccines, but is that satisfactory? No, still it is going on, but many challenges coming up, particularly whenever we see the Omicron variant, which seems that, so for information we have, it is worse than Delta variant, which means if we cannot take care of it, if we cannot take preventive measures or vaccinate more people, the fatality may be higher again. But the good news for US is like the death may not be as high as initial time. Particularly, we have a good amount of people has already been vaccinated. So that is a good news. They have some immunity, and in the other hand, in societal level, there is some herd immunity also in there. So in this map, you're seeing that the blue color means there is Omicron in the Michigan. Seems still there is no case in here, but it may come anytime because it's spreading, and virus like this, variant like this doesn't need any approval or passport. It can go anywhere, any place, anytime. Now, what are the facts so far we understood? Initially, the threat of COVID-19 was not really understood clearly, almost by every nation. And the WHO declared is like a pandemic, but we later found that it was not well coordinated among nations. They should have, let's okay, here is a pandemic and here is the formula or prescription to attack it or address it. And this is what WHO can do, and this is what nation states should do. The nature of the various viruses really isolate nation states. How? Because the global health really united the global nations. But this COVID virus, in fact, make a bar in there. It's broken down that kind of a unifications of the nation states of our global village. Then every nation is doing handling things in their own way. As a result, we didn't find any standard set of instructions that paid the price in fact globally, and not only delayed and increased the fatality, but it's a prevention measures is also hampered in there. And we noticed also the lack of worldwide standard. It's like some countries doing, okay, no, your mask is not necessary. We are not closing our schools. Some nations are closing the schools. So there was no specific standard to be followed. Similarly, we don't see any specific trend of success initially. Say, for example, Sweden was not closing anything, but still they are doing their case rate was low. Or later we saw that is their case rate is going so up, another thing. However, we noticed the positive thing is the vaccine really accelerated the progress, at least getting better result from the treatment point of view, or address the threat of the vaccine. Now, question might be why global health couldn't perform. Many factors. It's lack of preparation, and also resources to address. Say, for example, US can afford to spend billions of dollars to invent a vaccine. WHO doesn't have any, or global health movement doesn't have that kind of a resources. And the COVID-19 is an unique nature of virus, and also is a variant. If we compare with Ebola, the incubation period and also the mutation process is totally different of this virus in compared to other virus. So as a result, it is hard to predict what is going to happen. And you have to wait until the incubation period is over. And then also the mutation, what will be the nature of the mutation. Without understanding those factors, no health expert, including virologists, immunologists, public health experts, epidemiologists, can do what need to be done nation. So those are the struggling factors. National public health should be a prerequisite for a successful global health. That is, I always emphasize, because if a nation doesn't have any good structure, health structure, it will be very difficult for them to implement or address such a kind of a global threat. We also saw the inadequate coordination among world nations. For example, interestingly, CDC is so powerful as an institution, but that CDC role was kind of limited due to the kind of a invasion of political institutions. So that was not expected. We rather expected that CDC should take a lead, not only in the US, rather than globally. So that we didn't find. In another observation is like absence of global leadership. We saw a good leadership in attacking or addressing Ebola. Like whole US Army Brigade was positioned in Africa, and that kind of a threat was minimized within a very shorter period of time. We didn't see that kind of a robust and strong and effective and efficient leadership to address COVID-19. So many things can be taken. Now, question is, what is the take about the power of politics? Why I'm saying that is a power of politics? Because our society is run, is visioned, and also things are being implemented based on the leadership who is doing in politics. One author very nicely said the governance architecture of a state and the way in which power is operationalized are both critical in shaping how coordinated management and emergency preparedness are enacted within a political jurisdiction. So that we saw there is a lacking in there. And in the US particularly, the majority states have ignored contradictory federal messages and employed their resources and knowledge to manage the COVID-19 pandemic. So that isolated them. Even the United States lost its unification. It's lost its functional unity. And so each state was handling COVID in a different ways. That is not definitely expected. So what we are seeing in here, so that when US lost that unification, unity within its geographic location, it lost the leadership role globally as well. Who is in control to deal with COVID-19? Such a question was really much felt or asked by many people in the social landscape. So that that was interesting kind of observation from the health point of view. The autocratic leaders were hero in some cases, because it is maybe Russian Putin or a Brazilian president or the Chinese premier. So they thought because whatever they say, that is implemented exactly. As a result, they get the benefit. While the democratic countries, with their liberty, with their freedom and many other democratic rights, that are slowing down the progress and also the unified standard message in the air. So what we are seeing that democratic values really couldn't empower the people as we expect. So that is another lesson we see that. Now, whenever we talk about the power of people, people are really resourceful. Whenever you let them use their resources and their potentials. But this time, generally people felt powerless and helpless. People get power from their networking, from the institutions, including state level, federal level institutions. But those institutions are in a debate. But in the morning, someone is saying something, same person is saying something different in the afternoon time. So people get really helpless and frustrated. So lack of knowledge really make people more vulnerable and not resourceful enough. So that is the part we noticed. And there's a silo approach of using social network, which means if you're following maybe one TV channel and whatever they are saying, your behavior, your action is shaped by that. If you're following another different kind of a printed media, your thinking is shaped in that way as well. At that time, what happened, we are being isolated. We are home kind of a bound. We are staying on home. So whatever the comfortable social network people had, they are relying on them. And not always those network is knowledgeful enough or resourceful enough. As a result, people got different directions, different kind of information packages. And those really couldn't make resourceful, powerful to address COVID at the individual level. Now, whenever some media played a role, printed media role, many other people played a role. And interestingly, some social media didn't correct those information. This is not what you're thinking. This is what it is. As a result, there is an opportunity to be confused and frustrated. People with national unity, we found that are more successful. Say, for example, the information I have given you, the unity can be like a within people or as imposed by politicians. So whenever there is a unity and some policies being implemented at people level, they found some kind of a success and kind of a progress in that respect in there. So that is a good part we understand, that we have been really understanding that part. But personal freedom hamper success of COVID, because whenever you consider freedom, okay, say for example, US point of view, it is my right based on constitutional right to do this or that. No leaders can really enforce it to go in different actions. As a result, even though the more effective vaccines is being produced in USA, but the benefit of that innovation, we as a nation are not getting it because of those different kind of confusing messages went out to the people's door level and other things. So that was really unfortunate, I should say, because we expect that people will be resourceful, and it is the responsibility of the politician to make them people resourceful. Only then, whenever the political institutions and people can get together, any progress and any innovation can work effectively. See that we have a big COVID-19 problem. We have a vaccine ready, but still we cannot make the progress we are supposed to have a progress, because there should be very good alignment with progress, people, and politicians or the leaders. As long as we don't have that, we cannot really make good progress. So that is what I try to share in here, the power of progress. The progress I mean is like innovation. Maybe face mask is an innovation. That, okay, here is one, at least 20% of prevention is possible if you wear face mask. Here is a vaccine, you will be 80 to 100%, it will be secured from this virus. But it's a unique nature of COVID-19 definitely lingered this suffering. Initially, it was not easy. People thought it may be a virus like a flu, or it will go away. It's like H1N1 or Ebola. But no, as I informed you before, that the incubation period, particularly this mutation pattern, really make this virus unique and unpredictable sometimes. So, and there is a too much of diverse narratives hampers the progress. You can see from a very easy way. Say you have the problem, you have the solution, but still the problem is dominating you rather than the solutions, because two diverse narratives. Someone is okay, I don't need it. Someone is saying, yes, I'd like to take it. Someone is okay, if I take it, I cannot work. Or many other harmful complications will be coming in. So too many diverse narratives is coming on about COVID-19 and also the vaccine. And we also saw that medical and health science could not take the lead initially. That was, this is the first time, in fact, one of the time in the history of our human civilization that the medical science or health science couldn't come together, giving a one set of conclusion, one set of interpretation, one set of projection, one set of kind of a prescription that this is the reason it happened, this is the way it is happening, or this is the way you need to do to be cured from it. We didn't find that part. As a result, many people, in fact, blame people that, okay, this is the people's problem. I don't think so. If you're going like a different versions of statistics to the people, which one they should believe in and how they should move on. So, but whenever I think about the progress point of view, the innovation point of view, the innovation is costly. It is not easy to come up with a vaccine in a very short time. Or maybe if you dig into more, you'll understand that such a very vaccine was not developed in such a short time before. So in that case, we are lucky, and thanks to our scientific communities and other things. But the poor and middle class income nations depend on rich nations. That is, in fact, that is happening whenever thinking about the global health. But is that going to continue, or it is the burden of the global health is a burden of rich nations? Then if so, it may not sustain. That is what we are experiencing now. Global health was like going in a full speed. Now it is like going down sharply, because the global health as a movement is not well structured. It is not giving its strong footage. It is not giving us all the ammunition it needs to be successful. If you rely only on richer nation to support all over 7 billion population, it is not going to work. It is not going to work. So what ultimately happened is main philosophy of global health, like we are not alone, we are together, we will be take care of our health, each other, and globally will be a healthy nation. That has been compromised because of many, many reasons, particularly the cost issues as one of the big reasons. What we conclude, COVID-19 definitely is an unique virus in compared to other different viruses like Ebola, H1N1, or any other thing, certain viruses. And global effort definitely is needed, definitely needed. which not only US, not only China, not only maybe European countries will be handling the challenge and a threat of COVID virus. The coronavirus needs a global efforts. That efforts need to be really operationalized based on some practicality. It is not really feasible that if certain big threats come to our door next time, and everyone will be looking at richer nations. No, I think rather than everyone together with the leadership of WHO or richer nations, we should have a structure set up at national level. Although the poorer nations should also contribute something. Otherwise, it will be difficult to get financial resources only on certain pockets and distribute it among the global world. It may not be enough. So that's, everyone should take responsibility. Otherwise, global health may not be as effective or as successful as we expect. So at the end, what I usually conclude that the political leaders, who is the institution politics, the people, the society, and the medical innovation like vaccines, everything should be aligned and work together in a collaborative fashion. If we cannot do that, then we may not have the successful scenario or progress the way we expect. All right, that's what I wanted to share. It will be my pleasure to have a discussion and work with you.
All right, thank you, Dr. Molla, for this engaging and stimulating talk. So we'll open it to questions. Just raise your hand if you have a question, or just fire it. So any question, anybody would like to comment on any specific issues or engage with Dr. Molla on any of the topic he just discussed? Yes, Andy.
Hello. Thank you, Dr. Molla. That was so informative and helped me see it, the links between domestic responses and global responses. So two questions coming out of sort of film and lit. One is, your talk made me think of this book I use called International Politics and Zombies.
It's a good one, sir.
Oh, you know it. Okay, so there's this prediction in that book about that bureaucracies have an amount of legitimacy, amount of autonomy, and then crisis hits.
Yep.
And when they have that autonomy, they mess up because they're unprepared. And so the people trusted those agencies, and then when they start to pick it up and get in gear, they've lost that window. And so I was thinking about, that seems to be the story here in the United States, CDC now, but also Austria. I think it was France too, but there's been this pushback against expertise, especially bureaucrat. So my question is that really widespread, or is that just, am I looking at it through an American-centric lens? The other question, the movie Contagion had a much happier ending than what we're seeing right now. I don't know if you know the movie by Soderbergh.
Yep.
Okay, so they kind of figure it out. And there's a great deal of global cooperation. What did that movie miss, maybe, that you're seeing? Like, what was maybe one element that we needed from that happier story? Does that make sense?
Yes, great comments and questions, Professor. I totally agree with you. The way you explained it is basically, yeah, right. We have democracy and other thing, but the bureaucracy fail whenever there is emergency and kind of an unexpected situation come in. That's very true. Totally agree with you. And that's a great book. Now, question is, what can be done. So maybe understanding, looking at our own and try to be getting ready in terms of preparedness and other things. But is that going to work in future? Not sure until I see. I am not going to buy that kind of situations. But if we put side by side bureaucracy versus kind of a authoritarian regime, can we rely that authoritarian regime is doing the best? It is hard to buy sometimes, but we see that at least some statistics suggesting that yes, China, Russia is more successful, but what is the proof? That because they're telling the truth. So that may be another factor, because whatever is happening in US soil, everything is reported black and white. But can you assume that what is happening in Wuhan, China, or Beijing, China, or Moscow, we understand this? May not be. So that's it's hard to really compare to understand that. So I totally agree with you in that respect. And the movie, really, I like that positive tone. That's really, I was thinking that how come that a filmmaker, they can figure it out, why not politicians? What are they doing? If a filmmaker can have spend some time and come up with certain solutions and other things, that should be the kind of, every politician should really watch the movie first before they start working on it. So that is the part I see that. Only thing about the movie that if they can really expand to more audiences, that would be a very good educational tool, I should say. I think it's not only our students, our next generation leadership, because such opportunity is not available all the way in every space of the world. So if we can really distribute and make those available to other part of the world, that will be an excellent kind of a contribution from global health point of view. Other than I'm born and brought up in a Bangladeshi village, remote village, I should say that their cleanliness or environment is considered that if it is clean or not. If the water is looking clean, that's safe water to drink. So that's the way. They don't understand the pollution. Rather than they give, okay, take this water in the river or pond or lake, because that is given by the God. So from taking people's perspective from that narratives to a modern medicine, it's not easy. But certain kind of a film, they can make kind of a huge contribution to our daily life. I totally agree with you. Thank you so much for bringing up two excellent examples in there. Yeah.
Thank you.
Sure.
Any other question? Okay, I do have some comment and then question. Your talk clearly highlighted the promises and opportunities of global health governance, if you wish. And I would like to come back to the politics that has fueled misinformation, and misinformation in turn is what has contributed to vaccine hesitancy that we see around the world. And when you listen to the media, I think they are taking a simplistic view on the issue of vaccine access and equity. It's a little bit more complicated because I have friends in South Africa and Congo and other places. Even if vaccine were available today, they have made their mind, they have decided not to take it. So what we see in rich country like the US, the same trend, the same dynamic is at play in other parts of the world. So I just wanted to point out the fact that the issue of vaccine access and equity is not as simple as it might sound, because many indicators seem to suggest that in many parts of the world, for religious reasons and other reasons, or historical reason, people are not willing to take the vaccine. So I will let you comment on that later. And my other question has to do with this issue of vaccine dumping. The idea that the doses that are being given to other countries are often close to expiration dates. And oftentimes these are vaccines that are really not needed anymore. So the notion here is that, rich countries are just, dumping, whatever they either no longer need or whatever their own people don't want. They are just dumping it, to, developing countries. So I'd like to have your comment and thought on these two issues.
Yeah, sure. Thank you, Professor. I believe you understood the first one. You told that misconception of using the COVID vaccine. And the next one is talking why there is dumping happening. Am I right?
Mm-hmm,
Okay.
mm-hmm, yes.
So you in fact pointed out, you in fact responded your own questions in your comments box, but I totally agree with you that why certain things, even though important for your health, is not being used. Because we are human beings. It's like human beings are not, is just a physical or biological entity. It has some cultural factors, you have some social factors, some spiritual factors. There's some many different characteristics. Those are maybe invisible, kind of a rope or tide surrounded by a human. We do not see it. And all those factors, it may be their knowledge level, their family, their peer group, their own religious belief. Many things are shaping people's behavior. And accordingly, they will be act like that way. So until and unless we are addressing those, they may be right or wrong. Because if a person is born in an isolated place, whatever the exposure he has, he's knowledgeable about that, not the other factors. So that is one thing we need to be expand our knowledge level so that we can reduce the level of ignorance. Now, question is, there are some people who are intentionally being ignorant. What to do about that? So that again, there's some limitations about that. For example, we can offer some options. Okay, if you can take this vaccine, these are the benefits of it. Like the Professor Andrew was referring that video. That's an excellent piece of work. They must have, this is the way we can be benefited and other things. So be positive. Still, we can put ourselves in the shoes of those people and then educate them and show the benefit of vaccination. So that's the way it goes. For example, whenever we saw that in Michigan, even that the lottery ticket was announced, many people went there. And now whenever see that Omicron variants coming in, the booster dose administering level is going up. So people are really watching and they are understanding and they're making their rational decision. But we need to keep on feeding the appropriate information. But there's certain times will be coming, we can get frustrated, but that should not be the way to handle certain situation, because health within a society is beyond, like, forget about whole of US. Even though in Grand Rapids, there are different kind of ethnic groups in there. Say, for example, I'm being an Asian. If you ask me to, okay, hey, why don't you take burger for your food? I'm a rich fish person. So rice and fish is my main food. So that's the way I'll go. And it will take time to change that. So that is one thing, the cultural codes, it takes time to change. But if we keep on feeding people with information, things will be changing. Another thing. Vaccine dumping, I believe I addressed a little bit of that question. The vaccine dumping is a big issue coming in. Whenever a vaccine is developed, you know that from scientific point of view, there is some expiration date and there is certain temperature, particularly this Pfizer vaccine need to maintain certain temperature. Say, if we are sending something, vaccination to all the way in Africa, but they don't have the freezing situation, or Asia, they don't have the capability or structure to maintain that temperature level, keeping in that vaccine is safe and effective, then there is no other alternative. You cannot give a faulty, wrong vaccine to people that will be more dangerous than vaccinate people. So there's certain technical things, and also there are some structural issues. Sometimes people do not really understand. I hear many people from developing world in many other sessions that, hey, why we have vaccine and we have been taking other vaccines, we don't need to maintain any kind of a freezing temperature or any other temperature, and we don't have that. So whatever we have, we are using this. No, that may not be the solution. So whatever is required, you need to maintain that. Otherwise, you ended up with throwing out or dumping the vaccine that way. See, another thing is like distribution of the vaccine, that particularly the current White House has taken a very good global responsibility. They have listed some vulnerable countries around the world who cannot afford to have vaccine or buy it. And they have been sending millions of doses of jabs, of vaccines to those countries. That is a great initiative. That should be the kind of one of the big characteristics of global health. And that's the way people can be benefited out of that. So to reduce the dumping, we need to really improve the infrastructure and also the knowledge level, and definitely the motivation level as well, so that we can be benefited more. I hope I am at least address some of your some part of your questions. Right, Professor?
Okay, thank you very much.
Sure.
Any other question or comment? Okay, looks like there are no questions or comments. So let me take this opportunity to thank Dr. Molla again for this very interesting and engaging conversation on global health. So this ends our discussion today, and I wish you well, enjoy the rest of your day, and hope to see you again next semester for another series of the Global Express talks. Okay, yeah. Bye everybody.
Thank you so much. Andrew, we should keep in touch. I think I would like to share some of my ideas. We can maybe work together with you.
Okay, that would be great.
Yeah, thank you for coming in.
Wonderful.
Thank you.
Thanks, Andy. Yeah. Thanks, Molla.
Yeah, bye, Professor Mandela.
Yeah.